Meanwhile, interesting developments today where you had a group of public health experts, including doctors from the All India Institute of Medical Sciences and members of the National Task Force on COVID-19, who said that mass, indiscriminate and incomplete vaccination can trigger emergence of mutant strains. They also said that those who have already got the coronavirus infection should not be vaccinated. Now, basically, this runs counter to the current vaccination program, where the vaccine is available to everyone who is eligible, that is above the age of 18. Now, this group, in its report which has been submitted to the Government of India, has said that it is a haphazard way of going about vaccination, and it is the priority groups who must be completely vaccinated first before opening it up to the other age groups. Could there then again be a rethink on the way in which the vaccination program is being carried out? And what do they mean when they say that this haphazard and incomplete vaccination could actually lead to development of mutant strains? To get those answers, let's go across to Dr. Peter Lloyd Sherlock, Professor of Global Health and formerly Senior Advisor to the World Health Organization, and Dr. Soumitra Ghosh, Associate Professor at TIS, who's also a public health researcher. I will start by asking you, Dr. Sherlock, what exactly does the report mean when it says that a haphazard vaccination is going to lead to developing of mutant strains? Are they suggesting that the vaccination program as it exists right now in India is haphazard?
Well, good evening, and thank you for having me on your program. Well, I think haphazard is certainly one way that you might want to describe the way the vaccination rollout is being prioritized in India at the moment. My particular concern is that, as I understand it, about 200 million people aged 60 or more in India have yet to receive even one dose of vaccine. And of course, those are mainly people living in rural areas, people living in poverty. We know, looking across lots of different countries in the world, that if you're aged over 60, your chances of dying if you get COVID are about 50 times or even more than 50 times higher than if you're aged under 45. And what we find bizarre, haphazard, and very worrying is that over the last 3 or 4 weeks in India, more people aged under 45 have been getting the first dose of vaccine than people over the age of 60. And I completely appreciate that the supply of vaccine in India is extremely limited, and I completely deplore the position of my own government in the United Kingdom in terms of its vaccine nationalism. But, you know, what vaccine is available in countries like India surely must focus on those people who need it most: older people and frontline health workers. So that is what I would mean in terms of haphazard. Beyond that, I think there are some potential risks in terms of the development of new mutant strains. However, if you continue to vaccinate more people at younger ages than at older ages, you will continue to see what's been going on in India over the last few weeks, which is tens of thousands of deaths that could have been avoided. So this policy now of making the vaccine free, as I understand it, from the 21st of June to everybody between the age of 18 and 45 is going to further exacerbate that tendency to vaccinate people at younger ages instead of the people who are going to die of COVID. This is going to lead to thousands of relatively avoidable deaths. It's very difficult. These decisions are always very difficult. Prioritizing scarce resources across different groups is always a very difficult thing to do for politicians. But what is happening at the moment contrasts hugely to what's going on in many other countries I work in, including Brazil, including Mexico, where they have focused the vaccine on frontline health workers and people at old ages. And that has led to demonstrable benefits in terms of thousands of deaths being avoided over the last 2 or 3 months as they've rolled out the vaccine. So I probably haven't answered your question very directly, but for me, to talk about a rethink, yeah, absolutely, we need to focus more. But I think the big risk isn't a potential risk of new variants emerging. There isn't a risk here. There is an absolute outcome. which will happen, which is happening, which happened this week in India. Thousands of people died because they had been denied vaccine, whereas people who can afford it under the age of 45 were given it. And I find that very distressing.
Okay, Dr. Soumitra Ghosh, would you then advocate that instead of having the entire eligible population get vaccinated, maybe some of them get one dose and then have to wait for a longer time, it would be more advisable for all the vulnerable groups to get both their doses and then open it up to the others?
Yeah, I mean, that makes sense from the epidemiological point of view. I mean, absolutely agree with you, because the evidence suggests that if you look at the mortality data, the COVID-19 mortality data, out of 10 COVID-19 deaths, 9 of them are from the age group 60 plus. So if you have such evidence, it clearly points out that your priority age group is 60 plus, those who are ages 60 or above. So obviously, to protect this, the people who are above 60, we need to prioritize their vaccination. So yes, I agree with you that before opening up, and of course we already opened it up to other age groups, but I think we should have first vaccinated the priority age group. Yeah.
Do you, Dr. Ghosh, also agree with the argument that those who've already got COVID should not be given the vaccine at all?
Well, I think the evidence suggests that they're supposed to wait for at least a month after they recover from COVID. And as per the IP1 guidelines, they can be administered the vaccine after 1 month.
May I just interject? Certainly
the other thing that seems that seems. Yes, please go on, Dr. Sherlock. Yes.
I'm so sorry. Yes, just to say that there is no policy of discouraging people who've had COVID or think they may have had COVID in other countries from having one of the mainstream vaccines. This seems to be a concern that's being raised very specifically in India. Now, there may be a basis for that, but it is interesting to observe around the world that nobody else seems to be saying this. And of course, in countries like my own, where a very high proportion of people to get older ages have been vaccinated, many of those had coronavirus, and there don't seem to have been any consequences to date in terms of new variants emerging as a result of that. The main new variant we had in the UK emerged in late 2020, the Kent variant, and that was before anybody had really been vaccinated. So I think there may be some basis to it, but it seems a bit of a red herring. To me, the issue is that thousands and thousands of older people in India are dying unnecessarily because they're not being prioritized for vaccination. And that's where the rethink needs to happen.
The one part of this report that really stands out and has a lot of people worried, sorry to interrupt you, Dr. Ghosh, is where they say that incomplete vaccination can trigger emergence of mutant strains. How is that? Because there are many people right now who are due for their second dose, who've received one shot of the vaccine and are waiting for the second shot. Now, the report says that this incomplete vaccination can trigger emergence of mutant strains. How soon can that happen? And is there any evidence to show this has happened in any other part of the world?
Yes. I mean, once they receive the first shot, that doesn't mean that they become immediately immune to all the variants of COVID-19. So obviously, after a certain period of time, they need to get the second dose. Even if they get fully vaccinated against COVID-19, they still need to follow the COVID-19 protocols, like wearing the mask and use the non-pharmaceutical intervention to protect themselves from COVID. So currently, the evidence doesn't tell that if someone gets fully vaccinated, then the person totally becomes immune to COVID-19. But what it does tell you, based on the current evidence, we can tell that even if they get COVID-19, if they contract COVID-19, the disease form is going to be mild and moderate. So the person would not develop serious illnesses from COVID-19. So that's what the evidence says. So yes, I think WHO says that we need to get them fully vaccinated at the vulnerable population. We have a shortage of that.
Now, the report that has been given also seems to be in favor of the UK model, where they say that evidence-based flexibility in vaccine schedules may need to be considered for areas or populations experiencing surge on account of specific variants, a reduced interval for the second dose of Covishield, with areas that see a surge due to Delta variant. Dr. Lloyd, which is precisely what UK also did. On a day when we actually increased the gap, UK decreased the gap, and now this report says the step by UK may have been more wise.
Well, there may be something in that. I have to say, I think that you're still ignoring the big issue. We published a paper that came out in the British Medical Journal today criticising the government of India for not vaccinating its older population and prioritising people at younger ages. The Director General of the World Health Organization a few weeks ago, talking about a number of different countries, said there is a disturbing narrative that it's okay if older people die during the pandemic. It's not okay. Those are his words. And so I would put it to Prime Minister Modi, to the National Minister of Health, to the Minister of Health at lower levels of government in India, how can they justify either making people pay, and with reference to all of these other issues that you're wanting to discuss, how can they justify vaccinating more people, and we're not talking about health workers, under the age of 45 and over the age of 60, when we know that 200 million people over the age of 60 in India, relatively poor people, have not even had one dose. So before we even start to worry about when you should get your second dose, this may be a concern for middle-class people living in Indian cities, but for many, many of the most disadvantaged older people in India, at the moment, the vaccine policy, as far as I am concerned, is a death sentence.
All right. Interesting that, right now it's going to be a tightrope walk. What are you hearing, Dr. Ghosh, from the response from the government that we've had? Is there room or is there any wisdom in doing another rethink? Because we've gone back and forth thrice already.
Well, I think we remain optimistic about it, that the government would review the vaccine policy and take the necessary steps to save the precious lives. Because look what is happening in the major urban centers, like in Mumbai. I mean, in the first week of June, the PMC vaccination centers, the government vaccination centers, were shut for 1 week, whereas we have lots of vaccines available in the private sector, in the private hospitals. They have stockpiled the vaccines, and at the same time, they are not using them. On the other side, there's a situation the state governments were struggling to procure the vaccine. And I don't think that with the change in policy that the center would procure 75% of the total vaccine output, things are going to really change drastically. So I think there is a need to relook at the policy, and we should be, in fact, we should be procuring 100%. There should be 100% centralized procurement of all the vaccines manufactured in the country. And that is perhaps because now the centers would have made a say in terms of vaccine allocation. So there should be the national guidelines, which should be formulated earlier, with clear instructions to the states that who are the priority groups. Let's first vaccinate the priority groups and then come back to the other, relatively less risky ones, the low-risk ones, the 18 to 44 groups. But unfortunately, because we have given a lot of vaccines to the private hands, because in case of Maharashtra, I can give you a clear example, because right now, as per the last vaccine policy, 25% of the output goes to the state, another 20% goes to the private hospitals, whereas 50% is with the center. In case of Maharashtra, the private hospitals, they have garnered more vaccines. In fact, to be more precise, the number is around 38 lakhs, whereas Maharashtra could procure only 25 lakhs, vaccine doses. So that's the kind of difference that we see. And when the private hospitals they procure these vaccines, majority of these vaccines will be administered to the non-priority groups, precisely. That's the 18 to 44. So yes, I think there's a pressing need that the center must decide the policy, one more time, and fix it.
So, Dr. Sherlock, my final question to you is this, that even a double dose only ensures that one will survive the Delta variant, not that one will not get it. So is it not better that lesser people die of COVID than lesser people contracting it?
Well, clearly the two are related, but let's put it this way. In Brazil, they've had very high rates of infection over the last few months, but the numbers of deaths have been considerably lower by tens and tens of thousands than they would have been because they focused the vaccine on people at older ages. To save one life, when you vaccinate somebody under the age of 45, you need 50 doses of vaccine. To save one life for somebody over the age of 60, you need 1 dose of vaccine. That's the ratio, because older people are more than 50 times more likely to die once they are infected. And older people are just as exposed to infection as people at other ages, even if they don't leave the house, because they, of course, they live with other people, younger people who do leave the house. So I'm sorry to keep on coming back to this issue, but I think it's so important. India stands out as an exceptional country around the world, as a country which is vaccinating more younger people than older people. This is leading to tens of thousands of avoidable deaths, which could change. So I really, really beg the leadership, health ministers at the national level and at the state level, not to do this. They are in a position, by making a decision now, to save tens of thousands of lives. Those other issues you're describing are important, but are much less significant in terms of mitigating the effects of this pandemic on the people who are most vulnerable to its effects. And in poor families, of course, older people are often, the main breadwinner, the main source of livelihood, because they don't have pensions. They go out, they bring in support for the family. So I think what we need to do is we need to focus on those 200 million.
So far, the government that has got the report has refused to make an official comment about it, only saying that we are going to consider all the suggestions that have been made. However, how much this is going to impact the current vaccination policy seems very unlikely at this point. Thank you very much, Dr. Peter Lloyd Sherlock and Dr. Soumitra Ghosh, for having joined us with your expertise. Thanks very much for having tuned in. I'll see you at the same time on Monday.
The News Hour at 10 will be right back after the break.